one.
Thank you, Mr. Speaker. Mr. Speaker, I am ready to answer the valid questions by our honorable members, my colleagues. But Honorable Speaker, we are dealing with a very abnormal situation. And I want the House to look at the Public Health Act, Section 35 and Section 36. That mandates the Ministry of Health to take all the necessary action to protect and safeguard the safety of our citizens, our visitors, and all those who live within the borders of our country from any of the infectious diseases. To my sister, Honorable Sarah Koreri, but before even Honorable Speaker answer that question, first I think for information, we have 12 counties which are very high risk. These counties are Nairobi, Mombasa, Uasin Gishu, Busia, Kisumu, Bungoma, Trans Nzoia, West Pokot, Turkana, Homa Bay, and Migori. And this is because of the air, the road, transport, and the northern corridor. Then we have got high risk. The first one was very high risk. The high risk counties are 13. These are Vihiga, Kakamega, Nakuru, Kericho, Nandi, Kiambu, Machakos, Makueni, Kilifi, Taita Taveta, Isiolo, Elgeyo Marakwet, and Garissa. Honorable Speaker, again, for the information of the House, as of today, we have designated, verified 3 major hospitals as treatment centers. Kenyatta National Hospital, the Kenya National Police Hospital, MTRH in Eldoret. Secondly, we have also identified that we are in the process of completing the isolation, the treatment center of 2 hospitals in Busia. And I want to urge my sister, Mary Emase, even before COVID, the people of Busia and the country as a large, under the Ministry of Health, agreed that Alupe Hospital, a research center, is one of the very few infectious research hospitals. So in terms of qualification, that hospital is the most qualified because it's a research and infectious. Where have we done that? So in Busia, we have Alupe Sub-County Hospital, Referral Hospital, of these sites in the following counties. And Honorable Speaker, under the Public Health Act, we don't need to do public participation. We're not going to consult citizens. Even members of parliament here, when they fall sick, they rush to their doctor to make sure they get the best treatment. So this epidemic does not require any consultation. Tomorrow, God forbid, if Ebola is found in this country, this House will call me back here to this chair to ask me why are Kenyans dying. So before Kenyans die, before Kenyans are infected, we as a government have a moral, constitutional responsibility to protect both Kenyans and other people who are non-Kenyans who live within our border or who transit within our country. Honorable Speaker, on Laikipia Air Base is one of the 23 quarantine isolation center we are building. And we will not stop it. Why we are building? We are building in the airbase, far from even, and there are a number of reasons why. The runway in Laikipia is one of the longest runway. That is where we have KDF medical team. That is why even our 450 Kenyans who are serving today under the UN our special forces, the quick response unit. I'm the speaker, I was the Minister for Defense. I went to Ituri. I know all those areas. Those who have gone to Lumumbashi. Kenyans, the biggest hospitals in DRC are run by Kenyans, are owned by Kenyans. So we must protect, Mr. Speaker. So Laikipia will protect both Kenyans and the US. Honorable Speaker, when we had the COVID, and some of us were members of parliament here, the UN, the US, and many other international bodies built a hospital in Nairobi Hospital, a UN specialized hospital to deal with COVID. There was no noise that time. We have a responsibility to protect the
let him respond.
Honorable Speaker, on what the Secretary of State, Mark Rubio, said, that if it was said by the Minister, the Secretary of Health, I will respond. But I think that is an area for diplomats. The best person to respond to this House is the PCS. Because if it was my colleague, C.S. Kennedy, Alupe have answered very well. Laikipia we will build. Honorable Dini Nyoro, I think you are a bit very unfair. Because if all counties refuse to host isolation centers, the way you are suggesting, where will the Kenyans who will be infected, God forbid, go? I mean, as a leader, I don't think that way we can be irresponsible. And I agree with you, Madam Zamzam. Semen is part of the fluid. You are right. You are right. I saw people laughing at her. Body fluids. When we talk of body fluids, there are different types. Semen is one of the body fluids. So, Honorable Ndindi Nyoro, I really want to urge you, my very good friend, if we say every county refuses, then where are we going to treat Kenyans? Are we going to treat them up in the air? We as a government have a responsibility. We can still even create another isolation center in one of our barracks in any part of the country. If today it was in Mordecai in Garissa, in Isiolo, so it will treat both Kenyans and foreigners. And please, let us not politicize it. The document that we signed, and it was for the good of our country. It's the good of our country. It was good for our country. Kenya, Honorable Speaker, is number 2 in terms of healthcare delivery. South Africa is ahead of us. And very soon, even the US that you are praising, having a very good healthcare system, I can assure you, under the good leadership of President Ruto, we will become number 1 in healthcare delivery in another 10 years. Honorable Kimani, I have given all the 23 on our table of all the isolation centers, including, let us not politicize the health of our citizens. And I want to ask a question, Honorable Speaker. A Kenyan who is in DRC crosses today. He passes through the scanners in Busia.
Minister, you are not here to ask questions.
Yes.
Give a hypothesis.
No, Honorable, I want to compare with the US one.
Yes.
If a Kenyan crosses and then the scanners don't detect as having Ebola, the incubation period for this disease is 3 weeks. He comes and joins his family and the community. After 2 weeks, he's found to be infected with Ebola. What is the damage that Kenyan can cause? You know, we must look at how to save the nation. So we are more concerned about Americans coming, but we are not concerned about even the thousands of Kenyans, truck drivers who pass every day, go on there. We are just focused. Let us not make, Honorable Speaker, this thing a more of the Kenya Kwanza administration. The health of the citizens of our country is a collective responsibility. Those in government, those in the opposition. We can play around with anything else. Honorable Speaker, the Honorable Sarah Korere, there have been 16 other previous Ebola outbreaks in our country. This is the 17th one. So it didn't come with this government. COVID was not with this government. So, and then Ebola and all infectious diseases, they don't know borders. They cross. They can cross from anywhere. And we must make sure the isolation and treatment centers, including the one in Laikipia, are securely controlled. The environment, even within the Laikipia, in fact, because it's a military camp, is even more secure than the ones we are putting in the counties. Any one of us can be infected with Ebola, God forbid. Healthcare workers will be trained. Waste management will be done. Honorable Speaker, Honorable Mary Emase have answered a question. Honorable Ndindi have answered this question. I think there was Honorable Zamzam under the International Health Regulation Act of 2005, which this House has adopted. We are obligated. We are part of the global community. We are part of the global health security. Kenya is celebrated as one of the key leaders in global health security. We are obligated not only to take care of our own, but we are obligated to treat, to detect, and make sure even those who are not Kenyans, but who are within our border, must be taken care of, so that we are not safe until all of us are safe. I think the Honorable Deputy Minority Leader, my old colleague, the facility is receiving patients. What we have passed in the House was on infectious, biosafety, biological, which were all stipulated in the agreement. And Honorable Speaker, I have carried all the documents for this House. It was there before. You can get it from the Hansard, how it was passed, but I still have copies at the Ministry of Health. So quarantine is not only for Americans, even Kenyans will be isolated at the facility, and I have highlighted the huge Kenyan population in DRC and Uganda need our support. Honorable Speaker, I think most of the questions I have answered. The last one is, let our preparedness and response be dictated by science and not by politics. How we respond, how we protect our citizens from Ebola, which has no vaccine, it should be guided by science, but not politics. We'll go back to politics when we know the country is safe, the citizens are safe. And Honorable Speaker, finally, Nairobi is the center of the diplomatic community. The UN at Gigiri, the only one in the global south, extra 8,000 staff have been brought in the last 3 months. This is where we have the multilateral institutions. This is where we have JKI last year received 9 million visitors and about 3 million tourists. All those, plus our citizens, we must be cognizant of their health. Honorable Speaker, so Laikipia, Honorable Korere, the one on the land taken, I think it is this House again which has passed the agreement between us and our UK partners. So there's nothing illegal the government has done. Let's all of us be the voices and help us communicate to our constituencies that Ebola, and particularly this variant, is dangerous, it has no cure, and all of us must be vigilant and alert, and those of us in the health ministry, we will protect our citizens.
Order, Mary Emase. What is it, Emase? He has responded to your question. What is it you want to clarify? You want to recount what you said?
Thank you, Honorable Speaker. Honorable Speaker, I do not want to be misunderstood. In Teso South sub-county, I have 2 sub-counties. The only hospital I have